So what nursing is to me is a sacred science that combines our biological and physiological sciences and then the aspect of caring and emotional empathy and understanding. It is something that I don't think can be defined in one sentence, or even there's textbooks out there that try to define what exactly nursing is. I think it's a sacred practice, something that we are called into. It doesn't diminish from other healthcare professions or any other realm of practice or other professions outside of the healthcare field. But as nurses, we have a very unique window into patients in their most vulnerable state, and also not in different practice areas, maybe not a vulnerable state, but into an area where they're trying to improve or advance or cope with a chronic illness. So I think nursing encompasses this essence of being human and this lived experience of what we experience here on this earth, and trying to make it as meaningful as possible. When I was trying to decide a profession in the healthcare field, I knew I wanted to go into healthcare. I was dead set on either nursing or going on in medicine and being a doctor. I wanted to be a trauma surgeon at first when I was in high school. And so I shadowed nurses and I shadowed doctors, and I quickly realized that nurses were the ones that A, did most of the work at the bedside, but B, also made the connection with their patients and their families. And the patients that I talked to had a million nice things to say about their nurse and how they helped them through the situation, where they would praise their doctor for their knowledge. They didn't necessarily have that personal connection. And I wanted to be that person that provided that personal connection and help educate them through a scary situation or a situation that they needed help with their providing care for their child. And I didn't want to be the one just making or ordering things. I wanted to have more of a direct care with patients. So the most challenging aspect of my role as a pediatric nurse is kids. They are a great joy to work with, but they can also be one of the greatest challenges, from the normal 2-year-old behaviors to not being able to tell me what's wrong in the neonatal ICU, or the babies that are sick that can't say what hurts or what doesn't hurt. And also their parents can be, or caregivers can be, quite honestly, a really big challenge or a hurdle sometimes. But that's also the most rewarding aspect, is when you're able to connect with a toddler or a nonverbal autistic child who will open up to you or let you do something or let you listen to them for the first time. That brings the most profound joy when you can make that connection, or when you have a parent come up to you and say, "Thank you for how much you've helped me. I feel comfortable going home now with my child and providing care." So while parents and the child themselves can be really challenging, they're also the most rewarding aspect of what I do. When I think about informatics, I think the most challenging aspect is that most nurses don't like to think about data and how that influences the bedside. But also the most rewarding piece is when we can make a change that positively impacts the bedside using data and helping nurses understand that. If I could pass on one piece of knowledge, and what was passed on to me at the University of Minnesota was be open. Like I said, I thought I wanted to be a nurse anesthetist, and I thought I wanted to be a neonatal nurse practitioner, and now here I am getting my degree in informatics, and it has nothing to do with the bedside. Nursing is going to take you wherever you want it to go. You have the most profound responsibility in caring for your patients, but you also have a really great opportunity to advance yourself and learn and grow in whatever way you want to. You can be a pediatric nurse for 15 years and decide to go into adult ICU or adult emergency care if you want to. You can start off like me and being interested in anesthesiology and turn up to be a computer geek and working with data every day. So I think be open. Let nursing show you where you're meant to be. Let God show you where you're meant to be in nursing, and you're going to really enjoy the next, hopefully, 30-plus years of your career.
Nursing, for me, it is a multidimensional answer, but ultimately what it comes down to is being a servant and being selfless. And that was one of the biggest reasons that I went into nursing. I have a previous theater degree, and I did a lot of that, and I worked in sales, and I felt something was missing. And I wanted to come home at night and feel like I made a difference and that I was selfless and served people in my community, and I didn't feel like I was doing that before. And so when I went into nursing, that's really what I wanted. I wanted to be able to serve God through that, and I love just meeting people where they're at in the worst parts of their life and trying to show a little bit of light and a little bit of hope with them and for them. And it's not glamorous by any means. I mean, I've had stool all up on my arms, and I've had all sorts of nasty stuff happen to me. It's not glamorous by any means, but it is very incredibly rewarding, and I would choose it every day from here on out to do that. There's a lot. I'm still learning. I've only been a nurse there for about a year and a half, so there's going to be challenges forever. Get used to it. Time management has always been a big one, but that comes with time. But a lot of them being in the ICU is just the stress of it all, because we're stressed out with everything that we need to do for our patients, but seeing on the other end, the other spectrum, is the stress of the patients and the families. You know, in a life, or just in a split second, someone's life is being completely changed. They have a stroke and then they're completely paralyzed, or they're going to die, and trying to cope with that, being able to facilitate those conversations and just help people work through the dying process. And that it's just challenging, because you never expected to ever do that before. And that's takes a lot. In addition to patients that, things happen to them, just it's not fair, it's just a quick thing, but the patients that do it to themselves, we call them frequent flyers, that come in all the time because they're just not taking care of their bodies. And it's hard to have compassion multiple times for them. We know them by name, we know they come in all the time, and they're doing it to themselves. And that takes a lot of practice and a lot of patience and a lot of love. But those are probably the biggest ones that are challenging. Most rewarding, again, that's kind of multidimensional. First and foremost is being able to just provide that light for your patient and their family members. Just watching them smile one time a day really makes a big difference, and just being able to witness to them too. I love, some of my best days are just showing kindness to them and talking about their coping mechanisms, their spirituality. There's kind of a balance there, how much you can talk to them about God in the field. But praying with my patients has been incredibly rewarding, and I'd like to do more of that. And also just learning. Like I said before earlier, that I'm a huge nerd and I love pathophysiology, but I love to be able to just learn stuff all the time. And medical field is an ongoing learning thing. But being able to just help people, truly help them, and be there for them is just, it's so rewarding. That time management and coordination of care will come with time. Don't stress out. I was stressing out about that a lot when I first started, and I still do, but it comes with time. Don't be afraid to ask questions. People want you to ask questions. It means you're going to learn. And then you're going to see so much of God in this field, too. You're going to see God in a whole new light and be open to it as well. It's awesome. And then last, is a quote that I learned from nursing school, and I take it with me everywhere, is that people don't care how much you know until they know how much you care. And that's a big thing, because I like to learn a lot, but if I'm going to teach people a bunch of stuff, teach my family members or my patients about things, they're not going to listen, they're not going to care until they know that I actually care about them and their health and their personal lives too.
We meet people where they're at. So every single person that we meet comes to us looking through a different lens, and having that flexibility to meet them wherever you find them is what nursing is. So for me, I grew up on a farm, and I took care of my dad's animals from toddler on. I think I was a tomboy. I know I was, actually. And I followed him around the farm and watched him help cows have calves, cats have kittens, the dog have puppies, pigs have little piglets, all of those things. And when I look back on it, I think I developed a fascination and a sense of wonder in really how our bodies work. So it just made good sense for me to move from animals to humans and discover why the human body is as amazing as it is, and crazy to think that our bodies can heal from an injury. They can birth babies. They can grow babies inside them. That's amazing stuff. And so I think nursing to me means a sense of wonder and living in awe. So this is such a great question, and I'm so excited to give advice. I think that you need to never lose your sense of wonder in nursing, and you need to be willing to change. Lots of flexibility is necessary. I also think that you need to give yourself and your family and the people that you care for a lot of grace. The reality is to become a good nurse, you're going to make a few mistakes along the way. And along the way, you're going to have to pray that none of those mistakes are big mistakes, and that you live and learn from those mistakes, and that you just become better from them. Okay, so challenges and rewards in nursing. Surprisingly, I'm going to tell you that it's the people that are the most challenging, and it's the reward as well. And so I'll start with just challenges, and then I'll end with reward. I would say when you're a nurse, you care for people when they're in crisis. And so people are unpredictable, and they process things differently, and it's sometimes difficult to meet their emotional needs, especially when there are physical needs that you have to meet first. And so remembering that you're meeting people in a crisis is probably the most important thing, and it's the most challenging thing. As far as the reward goes, I mentioned that as a nurse, I live in wonder, and am surprised at how amazing our bodies are every single time I see a birth, especially. But I think the people are definitely the reward as well, even though they're the challenge. If I wanted to explore the way a really fascinating machine worked, I'd be an engineer. But I get to explore how human bodies work and be fascinated by that. But a part of our human body is our spiritual side and our emotional side. And so finding out what those pieces are from people is very rewarding.
Guess it's my life. I don't have any other words. That is all I know. And nursing is my life. When I finished high school, in my country, when you did high school, it was not up to 12th grade. It was 2 years that you had to go to school before you went to college. So when I was done with my high school, I went to teach in the school that was near my home. Next to it was a hospital that was run by nuns, and they were training nurses. I loved how they dressed. They had a green uniform, a white apron, and a white cap. And they were always looking so smart. I mean, smart as in neat. And they looked like they were very organized, and they looked educated. So I went and I talked to one of them. I made friends with one of them, and she told me that I could talk to her lecturer who would advise me on how to go about it. So I went to the talk to her, and she told me, Gladys, you don't want to come to this school. You need to go to an RN program. I was like, why? I think this is really good. She told me, no, the education you already have allows you to go get an RN. I was like, seriously? So she walked me through the process. For me, being a nurse, I liked the outfit that they had. Little did I know that I had a caring heart. And then you were asking about what is the rewarding. It depends on where I am at. If I'm in labor and delivery family birth center, it's when the mother sees the baby and she's excited, and you see how the joy they have as a family. When it comes to nursing students or mentorship, when I see somebody graduate from nursing school, especially those who did not think they would make it, and they've made it because I have encouraged them. When I see nurses who I have looked at, talked to them, advised them, mentored them without making it formal, and advised them to take a route that they did not think they would take, and end up loving what they've taken. That is just it's so rewarding for me. And I would really love to make sure that those who are behind me or those who are beside me are also doing the same, to encourage people to encourage nurses to advance their careers, because we are not here forever. We have to make sure that we do better in succession planning. So 10 years from now, when I will not be able to do what I'm doing, I am hoping that I'll have prepared others to be able to do better than I've done, and to move the career, to move the nursing profession to the level that we expect it in the future.